Cognitive and Behavior Neurology from University of Florida, a fellowship in epileptology and epileptology from Cleveland Clinic, USA, and a fellowship in interventional pain management from Germany. He's also a fellow of the Royal College of Public Health, UK. In 2009, he won the Best Paper Awards at the Kerala Association of Neurologists from Midterm Meet and the annual meeting of the Neurological Society of India. He has authored a few books, 3 books, and is a consultant editor to an international journal of psychology. I don't really want to go into the details of the physical effects of alcoholism. I want Dr. Praveen to give a detailed summary of all this. Just give him 20 minutes and 5 minutes for discussion. Thank you.
Thank you very much, sir, for your very kind words of introduction. I wish to thank Dr. Shahul Amin for giving me this opportunity to speak to all of you, and also for using some of his slides. I'm sure it's been a very long day for you, and most of you are really tired, sleepy, want to go back home, so I'll keep my talk as light and short as possible. I'm not sure if somebody has dealt with this earlier, but a brief history of what exactly is alcohol. Alcohol is derived from the word al-kuhul in Arabic. It means something which is finely distilled. Anything which is finely distilled, they used to call as alcohol, including the things which are used for using, as eyeliners, surumi. For that also, it is because it was so finely powdered, very finely powdered. So that was alcohol. And that's exactly the same mechanism. When you distill something very fine from the distilleries, from grains, from fruits, you still call it alcohol, right? It's very, very old. Can you guess how old this beer jar is? Can anyone guess? Any guesses? It's from the Neolithic age. It's about 10,000 years before Christ. They used to be drinking beer from jars way back then. Do you know who this is? Yes, he is the Greek god of wines. I'm sure among gods there are competitions as well, because the person here is Osiris. He is also a god of wines. Only thing, he's the god of wines in Egypt. The other person is in Greece. Right? I'll just get on to a very basic aspect of the absorption of alcohol. Alcohol goes down through the esophagus, reaches the stomach, where a small proportion of alcohol gets absorbed. Contrary to most of our understanding, most of the alcohol is not absorbed from the stomach. Majority gets absorbed from the small intestine, so almost 80%, right? So that's with regards to the absorption. Now, what are the factors which influence the speed of absorption of alcohol? The first thing is the concentration of alcohol in the beverage that's being taken. Now, you might be wondering, if the concentration is more, let us say in something like whiskey, that means there is more absorption. No, that's not true. Maximum absorption takes place between 15 to 20% of alcohol content. So whiskey is around 35 to 40%. So that's the maximum rate of the concentration of alcohol which gets absorbed. The lower the content, for example, in beer, where the alcohol content is just less than 5% or more than 5, just around 5%, there also there is a slow absorption. It stays for a longer time. And if the concentration is very high, let's say in whiskey, even then the absorption is slightly slow. As I said, 15 to 20% is what has got the fastest absorption. The amount of alcohol consumed, that's very logical to assume that the more alcohol, the more the concentration is, the BAC or the blood alcohol concentration is. The rate of alcohol consumption, again, logical to presume that the faster you drink, the more faster it comes into the bloodstream. And use of soft drinks, which hastens the absorption, just like you add sugar in many of the cocktail drinks. And of course, the amount of food in the stomach. Now, this is very important. People who take food along with alcohol, the absorption gets a little delayed. So if the concentration of alcohol was to be reached, say, between 5 minutes to 60 minutes in a person who is taking it on an empty stomach, it would be about 120 minutes, almost 2 hours in a person who takes it along with food. And sex, what I mean is gender. So men in general, they tend to have a slower absorption than women, which means that women get a high very faster. That's again with relationship to the general understanding that the body fat is slightly higher in women, and fat has got little amount of water for distribution. So alcohol has got an affinity for water, so it gets distributed more in water tissues, water containing tissues. And so in women it will be a little faster because there is more fat. Old age, mood, these are the other aspects which also influence the speed of absorption. And of course the metabolism. So rapid metabolizers will have faster absorption of alcohol. Weight, again, the same thing which I mentioned about fat. Briefly about the neuroanatomy of intoxication. Now these are the areas in the brain which get affected by alcohol. The basic pharmacology would probably already be discussed by the previous speakers, especially. You just need to remember two important neurotransmitters. One is GABA, the other is glutamate. So when it comes to, inhibitory neurotransmitters in the brain, like GABA and glutamate, what essentially happens is alcohol has got an affinity for GABA receptors, especially GABA A receptors. When you have inhibitions, when the inhibition is cut down, what happens? They excite what I'm coming to. Alcohol acts as a central nervous system depressant. How many of you would like to disagree with me? Because if you have seen people who take alcohol, they are ever so excited. They are ever so, full of josh, at least the earlier stages before they go for a blackout. It doesn't look like their central nervous system is depressed. Now this is because, this is purely physiological, because what essentially depresses is very important inhibitory circuits in the brain. Inhibitory circuits in the brain is what keep you, kind of very gentlemanly and being ladies over here. If those inhibitory circuits were not there, we would all be more like our, brothers in the lower rung of the evolutionary ladder. So that is what it suppresses. And so, because it suppresses those important circuits, the person gets excited in the initial stages of alcohol intake. So, some of the important areas of the brain where alcohol generally acts, what you see as number one is the prefrontal cortex. Now, the prefrontal cortex is that area of the brain which is very important in decision making, in coordination of important activities, what you're planning and coordination. It lets you see into the future. They say when you begin to plan for the future, you need to make very important decisions, logical decisions, based on your previous memories, previous experiences, and all these put together allows you to take the right decision at the right time. All these functions of the brain are generally called as the executive functions. So the executive, which are near the skin. So you can find, notice some people with a very flushed appearance after alcohol. They're so red, they're so puffy. That's because of this dilatation. So what exactly happens? When our blood is closer to the deeper vessels, it keeps the core body temperature warm. When the peripheral vessels get dilated and there is more circulation there, it leads to more heat loss to the external environment. So these kind of persons have a higher chance of going into what is known as hypothermia, especially in the cold countries. They might end up with a frostbite or a hypothermic episode where they can even go for a coma, because hypothermia can affect many other systems, including the heart.
His blessing to run this program successfully. Today there were 6 scientific sessions. I would like to thank all the speakers and chairman of today's scientific session who have come over here to share their valuable experience and knowledge with us. I would like to thank Father Sony, director of this institution, for his encouragement and support. Dr. Shahul, psychiatrist, the backbone of this program. Without him, the program would have been a successful one. Thank you, sir. I also extend my heartfelt thanks to Mrs. Ashwati, Principal, College of Nursing, for her guidance and support. My sincere thanks to HOD, Department of Psychiatric Nursing, Mrs. Bonsi, for her expert guidance in organizing this program. I cannot forget in thanking of the counselors of CFAR for their hard work and effort put together for the outcome of this program. I appreciate and thank all the delegates for your valuable presence. I express my thanks to all my third year basic nursing students who worked with us all through for the success of this program. Last but not least, I thank all the teaching and non-teaching staff who have directly and indirectly supported us. I also thank organizers for giving this opportunity. Thank you all.